Aloha, welcome to the Sports Medicine Clinic. My name is Dr. Joshua Peiper, and today I'm going to demonstrate a self-myofascial release and muscle energy technique for the QL or quadratus lumborum. The QL is a deep lower back muscle that occupies the soft space between the top of the pelvic bone or pelvic crest and the bottom of the lowest or 12th rib. The QL also attaches to all 5 of the lumbar vertebrae and can contribute to a hip hike or anterior pelvic rotation on the same side as the dysfunctional muscle. To achieve the ischemic compression component of this technique, we are going to look for 3 to 4 myofascial trigger points or tender spots within the QL and apply force through the lacrosse ball for 20 to 30 seconds each, or until the tenderness within those points becomes less tender or less intense. To achieve the self-myofascial release component of this technique, we are going to apply direct force into the fascia in the area through the ball for at least 1 to 2 minutes. It is important to note that while performing this technique, you want to avoid applying direct pressure or force to the 12th rib or the lowest rib with the ball. I'm going to start this technique by placing the lacrosse ball in the soft area just above the pelvic bone. Then I'm going to turn at a 45-degree angle to the wall so that I can apply force into the QL. So I'm going to look for tender points within this muscle in the fascia in this area, and every time I find one, I'm going to stop and apply direct force into that tender point for 20 to 30 seconds. As the tenderness within those points decreases or becomes less intense, I'm going to try to locate other tender spots or other myofascial trigger points within that same muscle. For the muscle energy technique, we are going to lean or side bend away from the affected muscle until we reach the first barrier, or we can feel a slight stretch within that QL. So we're going to stay out here at this new barrier for 10 seconds, and then we're going to resist trying to side bend back to the upright or neutral position for about 5 seconds. At that point, we're going to relax and side bend just a little bit further to the next barrier, and then hold this new position for about 10 seconds. We're going to resist side bending back to neutral again for about 5 seconds, relax for a second, and then side bend away just a little bit further. And we're going to repeat that cycle about 3 to 5 times.